So let's talk about transient osteoporosis of the hip or transient bone marrow edema syndrome versus subchondral fractures and AVN. This is a case submitted by Ferdinand in the virtual MSK fellowship. He posted this case and we can nicely see the images here. And when you look at the case, you can immediately see there is an extensive bone marrow edema in the anterior aspect of the femoral head on the right side. We see the effusion. We got some ellipsoid bursitis and maybe a ganglion cyst tracing up here, which is not relevant for the case at this point or for the purposes of this video. And when we look at the sagittal here, we can see there is quite a good amount of bone marrow edema, a little bit less than half of the head. But we can see this area here in the direct subchondral region, and this is consistent with a subchondral insufficiency fracture. Now I go straight for the fracture here. I wouldn't use the term transient marrow edema syndrome or transient bone marrow edema syndrome, or even certainly not transient osteoporosis of the hip, because that's not a term we should use on an MRI anyways. So what's the difference then between a transient bone marrow edema syndrome of the hip and a subchondral insufficiency fracture? And in my opinion, there's not much of a difference, to be honest, and I will show you why. Some people make these strange distinctions, but I think it's arbitrary, and I think it's just imaging that got better and better, and nowadays we can actually see what's going on, and these are actually subchondral insufficiency fractures. And there was a nice article a couple of years ago with 155 hips, and they saw that this, and this has been suggested before, it's more prevalent in men, like 75% men versus only 25 roughly in women. And that's one thing. So the whole osteoporosis theory would not make sense much, because we would expect women to have more prevalence in osteoporosis, and maybe we should see this transient osteoporosis more frequently in women. But interestingly, if you go to the article, and I think they have it in the abstract, they say subchondral insufficiency fractures were present in 50% of the cases. And this is very interesting, because why is it not just a subchondral insufficiency fracture if nearly 50% of people have it, of this group? And I think at one location they also talk about that in previous studies subchondral insufficiency fractures were only seen in a couple of, maybe less than 10%, and they argued as well that better image quality now shows more fractures. And I think the best part in this study is actually, if you look at the DEXA scores, they have a couple of DEXA assessments in patients with this transient osteoporosis of the hip, and you can see the T-scores are all really bad. Most of them would classify, or at least half of them would classify as osteoporosis. Most of them have osteopenia by any definition, and only one is kind of borderline here. So I think this really shows that even if we have a lot of men, even those have low bone density, meaning that ultimately we are looking at a subchondral insufficiency fracture. And that's the term I'm using, especially as soon as I see a fracture line or something irregular at the subchondral region, I go straight for the subchondral insufficiency fracture, and I don't have to worry about the term transient osteoporosis or transient bone marrow edema syndrome, which I think is going to be replaced anytime soon. Anyways, now this is just my personal opinion. Similar like in the knee, where we don't use the spontaneous osteonecrosis of the knee anymore, we just go straight for the subchondral insufficiency fracture. Okay, subscribe for more educational MSK radiology videos, and I'll see you in the next video. Bye bye.